All right, today we're diving into a really fascinating corner of exercise physiology. We're talking about the VO2 max time limit test. And you know what? It's a tool that measures something completely different from an athlete's raw peak power. So we've all seen pictures like this one, right? An athlete masked up, pushed to their absolute physical limit. This is your classic VO2 max test. It's all about finding that one single number, the maximum amount of oxygen a person can possibly use. It's really the gold standard for aerobic testing.
But what happens when you can't push someone to their absolute max? I mean, think about it. What if you're working with a patient in cardiac rehab, or maybe someone recovering from a long, tough stay in the ICU, or even a person with a chronic lung condition? For them, a test like that it's not going to happen. It's not feasible, and it might not even be safe. So what do? How do you measure their endurance?
And that very problem, that need for a different kind of measurement, brings us right to what we're calling the endurance question. It's a really critical challenge, especially in clinical and rehabilitation settings. Here's a way to think about it. It's like one test can measure the absolute highest note a singer can hit for a split second. But another test, and you could argue a more practical one, measures how long they can hold a powerful note. That's the real difference here. Peak power versus the ability to actually sustain that effort. One tells you the ceiling, the other shows you what someone can really functionally do. And that is exactly where this different kind of assessment comes into play. It's a test that's remarkably simple, but, as we'll see, incredibly powerful. So what is this thing? Well, technically, it's a protocol where a person exercises at a constant high intensity, usually set right around their VO2 max. And then we just time them. We measure exactly how long they can keep going before they have to stop. That's it. So let's cut through all the jargon. At its heart, this test answers one beautifully simple question. How long can you keep up a really, really hard effort? That's the number we're looking for. Okay, so how do you actually do one of these tests? Let's walk through it. You'll see it's surprisingly straightforward. First, you've got a short warm-up. Easy enough. Then you set the intensity. Now this is key. Unlike a normal VO2 max test where it gets harder and harder, here the difficulty is fixed at a very challenging level. The person just goes for as long as they can at that one speed or workload. The second they signal they're done, that's called volitional fatigue, the stopwatch is stopped. The result isn't some complicated oxygen value. It's just time, pure and simple. So now we have our result, right? A number, in minutes and seconds. But what does that time actually tell us? This is where a simple stopwatch turns into a really potent diagnostic tool. You know, the interpretation couldn't be more intuitive. A longer time means better endurance. Simple. A shorter time suggests that a person has a lower tolerance for that kind of aerobic work. It's a direct functional measure of their real-world stamina. And to put some numbers on that, an untrained person might last somewhere between, say, 2 and 6 minutes. But a trained individual, they could push past 6 minutes, sometimes even hitting 12 minutes or more. So right away, you have a clear spectrum to see where someone falls. So why is this so important? Well, the applications, especially in clinical settings, are huge. This test is used to assess someone's basic functional capacity, to track their progress during rehab, to evaluate the impact of chronic diseases like COPD or heart failure, and even to help design perfectly tailored exercise plans. Let's make this real. Imagine a patient starting cardiac rehab. On week 1, they can only hold that high intensity for 3 minutes. That's our starting point. 6 weeks later, you test them again, and now they can go for 7 minutes. That's not just a number on a chart. That's a massive, real-world improvement in their health and their quality of life. And look at these two examples. A patient who just got out of the ICU can only last 2 minutes. Right away, that tells us they have a very poor aerobic reserve. Or how about a patient with COPD who has to stop at 2.5 minutes because they're out of breath? This test gives us a hard number that quantifies their exercise intolerance, which is so valuable for planning their therapy. And all of this really points to the test's single greatest strength, its practical advantage out in the real world. Now, of course, no test is perfect. It has its pros and cons. The advantages are pretty clear, right? It's simple and it's super sensitive to changes. But you also have to consider the limitations. The patient has to be really motivated, and it's definitely not for someone who's very frail or medically unstable. And this brings us to the most important takeaway. For rehabilitation, These time limit tests are often just way more practical than a full-blown VO2 max test, especially if you don't have all the fancy equipment or if the patients just can't handle a test that keeps getting harder. So, the really crucial point here is that we're shifting the entire focus. We're moving away from measuring a theoretical peak capacity, and we're moving towards tracking something so much more real: functional endurance. It's about what a person can actually do, what they can sustain in their everyday life.
And that leaves us with a bigger question to think about, doesn't it? When we really consider what it means to be fit, is it more about the height of your peak, or is it about the breadth of your endurance? That simple, powerful ability to just keep going.